their research project topic ready to go. And I figured I'd give you the more formal assignment so you know what it is. So in case it's something you want to get started on, um, you have all the information you need. It's not due until December 3rd, right? So it's you've got a ways before you have to have it finished, but it's probably something you want to be working on. Um, so that is, how many weeks is that? That is 1 week, 2 weeks. That's like 3 weeks from now. So you've got, you need to get it done, but it's not a super rush, but you don't want to just wait till the last moment because it's too big to do all at once. So research project, paper and research project, PowerPoint presentation, they are both the same basic thing. The PowerPoint presentation is just a PowerPoint presentation based on what you wrote in your paper. And I'll click this so you can see what it looks like. You will write a research paper on a current topic. So this is basically just talking about the same thing that you saw when I assigned you the first step, which was pick a topic. It's basically, it's important that it's working with peer-reviewed articles. It's important that you use enough references and that you use them well in how you support and document your work. Kind of go on and on. I talked about most of you are doing it individually. There's, I think, one pair. If you're in a pair, this is kind of talking about the additional thing you need to do in terms of documenting who's doing what as part of the project. And things that you'll lose points if you're not using scientific articles or unreliable websites, cherry picking references to support one viewpoint that's not looking at the whole range. And then also making sure, so here's this rubric. This is kind of the things to think about, like how are we actually grading? So let's talk about this. Integration of knowledge. This is basically that, you're taking, what do you want to do? What's the information? Are you putting it together in a way that shows that you really get it? Topic focus. Like I've mentioned, in science, some of the interesting things are way too broad. You have to be able to focus in on something that's not too narrow, but not too broad. So topic focus means, are you biting off like a reasonable amount in terms of like what you're actually talking about? You might be interested in something, but if you try to cover every aspect of it, it's too much. So you have to kind of make sure, and if you're curious, you can, there's enough time you can ask me questions. I'm happy to give you feedback on your approach to these things. Depth of discussion, it's what it sounds like. Cohesiveness, it's also kind of what it sounds like. Is it kind of really scattered, or do you actually tell a cohesive story? Or is it just a bunch of random pieces that if I didn't really know what you're doing, I'm not even quite sure why this piece fits into the rest of the pieces? So, spelling and grammar, you will lose points if you don't have good spelling and grammar, because the whole point here is communicating. Our library will help you with this. You might have friends who help proofread things for you, but do be advised that spelling and grammar actually are important. And then the sources and citations are important. You need to have adequate sources and relevant sources that are supporting your discussion points, as well as having them properly cited, the way they're cited within the text through those inline references and cited properly in your list of references at the end, using that what we modeled in the our initial literature search assignment. So are there any questions about the overall assignment?
Are there a certain number of references that you want us like to have as like primary research versus, I guess, reviews? I don't.
Not necessarily.
Okay.
Not necessarily.
Dr. Egger, you may have said this, I'm sorry, my son is here, but how many pages did you want it to be?
You know, however many pages it needs.
Okay. Okay, cool.
I mean, I would say if you write this thing and it's just like 2 pages long, that's probably not enough. But if you write it and you're getting to be 20 pages, like, you know, you should probably like, you probably, that's, I mean, that's kind of part of this topic focus. You know, so, I mean, I don't want to say a like actual thing, but you know, somewhere between, you know, 5-10 pages should be enough to do whatever you're going to do here.
Okay, perfect. Thank you.
Other questions about the assignment?
Sometimes it's hard because the peer-reviewed articles are very, very specific. So sometimes it's easier to go to like a non-primary website to get background information on it. Can we do that? Like just bring on statistics and stuff, but then have primary research as well?
I would say you know, no, I wouldn't use it as a reference. You might use it to help orient yourself, but even those, if they're a good one, they will actually connect you to actual primary literature. Because if you get background information off of a website, you know, it's not actually clear that it's actually true background information.
So then we really shouldn't be using any sources other than primary and secondary.
Yes.
Okay.
And again, like for your own background reading or whatever. But, you know, I can say as somebody has found lots of issues like on Wikipedia, you go on Wikipedia, you often get something that is, you know, very limited or very biased in, you know, looking at something from one particular point of view, or sometimes way worse, even things that are, in fact, I remember once going on Wikipedia looking at things on lymph nodes, and they had the lymph flowing backwards through the lymph nodes, like coming in the, you know, there's usually lots of things coming into a lymph node and very few vessels leaving a lymph node, and somebody made a picture where the arrows were going the wrong way. You know, so Wikipedia, so that's why you really, it's not just about like, oh, but we want to be like pedantic here or whatever. It's really, if you really want to trust that this is something somebody found and not something somebody made up or somebody misinterpreted, you really don't want to do some random website.
Yeah. So even like if I went to the National Institute for Mental Health, I mean, that would, I mean, it's not a primary source, but it's a pretty reputable source, but we still shouldn't cite that then.
I mean, if it's something that plays into your narrative, but it's not going to be, if it's actual like data in terms of like incidents of mental illness,
Yeah.
there's going to be a paper that they got it from.
Okay. All right.
Yeah. So that's what I would say. Anything that is on a site like that is coming from an actual like research paper. So, and again, if you have particular questions or curious about something, just email me and I will do my best to kind of make sure you're on the right track with this stuff. So any other questions about the paper? The paper will be due on November 3rd and will be submitted into turnitin.com. It's just basically you click it in here. And then in addition to the paper, you are also going to have the PowerPoint presentation. You know, 10 slide PowerPoint summarizes your findings that other students will be able to view and comment on. We'll do these both to actually present to other students in our Zoom class, as well as you're going to be part of your grade is going to be going and making comments on other people's research projects. So this should just be adapted from your paper, though. This is not a whole new thing. This is just kind of taking the, kind of in a nutshell, your paper and putting it in a PowerPoint form.
Are you
and-
expecting to see like graphs and stuff that maybe we've put together, or something that's like was shown with the primary research? Or I guess how do we make it like kind of look interesting?
Yeah, I mean, and usually if you want to show your results, it's going to be in a graph, or, I mean, but no, it's not. It depends. It depends on what's appropriate.
Right.
Right. I mean, let me see if I can, I don't know if I can find it. Hold on a sec. Um, oh, here, in fact, I can show you what they look like. Let me do a new share. So I'm assuming, yeah, I'm gonna like assume that people aren't gonna mind that they're, they look like this. Effect, kind of defining, there's, but so this, she did this actually a little, normally you'd put the references in the thing. Let me find a different one.
Like at the bottom of that same page where you posted the picture, like.
Yeah, like here,
like that.
she's talking about neurotrophins and exercise, giving kind of the main things that she learned, and talking about influencing production of brain-derived neurotrophic factor to help prevent cognitive degenerative disorders. And then here's the reference that that supports that. Here's more things. So she's talking aerobic exercise, and here's so it's kind of like this. It's just, here's the main, and here's the conclusion, and here was so what she was looking for, what she kind of found, some of the major things she found that were interesting, and kind of tie it all together. It doesn't have to be, this is this, oh, this is not what happened there. Sleep for athletes. So again, here she's talking about what is sleep and giving some background, and then about different kinds, talking about, now here she's getting more specifically in sleep deprivation and athletic performance, different things, blah, 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 in the conclusions. So, it's kind of like this. This one is kind of a little prettier, so if you, depending on how much time and your skills and your aesthetic sense, you can make it prettier, or it can be just more kind of utilitarian. You're not going to get graded on aesthetics. You're just going to be graded on content. So I don't know, does that help? Does that help there?
Yeah, thank you for showing those.
Sure. So we're going to do now is go back to the blood pressure lab. We're going to continue this one. And let's see, we have a reasonable amount of time. I think the other thing I think we are going to do before today is done is I really do want to finish up cardiovascular in order to make sure we finish all the material. So I will probably spend, we won't spend a lot of time on blood, but we'll spend a little bit of time on blood because we need to talk about a little more details. We talked about red blood cells, but we need to talk a little bit more. Talked a bit about blood clotting and platelets, but we got to talk a little bit more. We talked a bit about plasma and plasma proteins, but we should talk a little bit more. White blood cells, in general, we're going to focus on when we get to the immune system. But so we'll probably spend like 15 minutes or so finishing up the blood before we're done. But let's do the blood pressure to kind of break things up a little bit. So first thing everybody should remember, how would you take somebody's blood pressure? If you were curious about somebody's blood pressure, what are the tools you use and what's the process you use?
Sphygmomanometer.
You got the sphygmomanometer, which is that thing with a bladder that you inflate around your arm with a little pump and the needle valve, as well as with the manometer with the pressure gauge. What else do you need?
Stethoscope.
Yeah, the
Stethoscope.
So the stethoscope. What's the process? What's the actual procedure then?
The patient has to be in a rested position, seated, and with the arm and rest in the armrest. And you have to locate the brachial pulse.
Yeah, so again, that's what I was mentioning at the beginning of class today. It is actually important that you know where the brachial artery is and how to feel that brachial pulse, because that is going to be the place where you need to put the stethoscope to listen for the sounds of Korotkoff. So, all right, so you've got your subject ready to go. You know where their brachial artery is, and now what?
You put the part of the sphygmomanometer, impossible to say for me, inside, making sure that it's the right size,
Yeah,
so it's not too tight or too loose. Wrap it with the stethoscope in the brachial artery, so we're listening to the pulse, and then we make sure that the I don't know the name.
So the
The valve.
Yeah, the little needle valve is closed.
Needle valve is closed.
Yeah, because those are two things that happen at this point where people get off track. One is they start pumping, and it's not inflating. It's because they didn't make sure the needle valve is closed. So you need to make sure the needle valve is closed so it actually will inflate. The other thing, sometimes they start pumping and all of a sudden the cuff starts like unvelcroing off the arm and they're like, whoa, what's going on? That happens sometimes it's hard to tell which is the inside and outside of the cuff because the Velcro works either way. So if you ever start inflating the cuff and it starts, unvelcroing itself as you inflate it, that probably means you just put it on inside out. All you have to do is put it on the other way and it'll be fine. All right, so we pump, how far do we pump it up? How about somebody else now? Tag team.
160.
Yeah, so something around 160, 180, someplace where you're pretty sure you're going to be above systolic. If you are the woman in the video, you can get more fancy pants and find that pulse obliteration or whatever. But, I usually just pump it up to, somewhere around 160, 180 or something. And then again, you don't leave it there because at this point, you've got a tourniquet on them and it's going to start getting uncomfortable. So what happens next? What are you going to hear? What do you hear in the stethoscope once you've pumped up the cuff?
Nothing.
Nothing.
Nothing. And how come you hear nothing?
Yeah.
Because you've cut off the blood supply to the brachial artery.
Exactly. There's no blood flow because you have the pressure in the cuff is greater than the blood pressure, so no blood is making it past the cuff. And then now we tweak the little valve, air's coming out. What happens as the pressure starts dropping in the cuff?
The pressure of the brachial artery starts to come through, and so you start to hear the pulse a little bit.
So, I mean, hearing the pulse is probably the wrong word. You hear the,
Yeah.
You're hearing the blood.
Laminar flow.
you're hearing that turbulent flow, that's those sounds of Korotkoff. So what does that tell you? When you start hearing that tapping sound, those sounds of Korotkoff, what does that tell you?
Pressure of the brachial artery is greater than the pressure of the cuff.
Yep, so we're now dropped below the highest pressure of the blood. So what do we record that as? What's that going to be for us?
Systolic.
That's going to be systolic. And then again, you keep letting air out. And again, you want to keep it going like a couple of millimeters of mercury a second. So you don't want to linger too long because again, it gets uncomfortable. And at some point the sounds disappear. What does that mean when the sounds disappear as you keep letting the air out?
Blood's returned to the normal smooth flow.
Exactly. So now it's smooth flow. There's no compression of the artery anymore. Again, silent again. And it's important, like when you're thinking about this, right, during this process, you have silence at the beginning, silence at the end, but for very different reasons. And again, that's going to be the diastolic pressure. When the sounds disappear completely due to laminar flow, that means there's no compression at all on the artery, and therefore we're below diastolic pressure. Now, so normally if we were in lab, we would have spent the first part of the day kind of getting used to how to take the blood pressure. Then the next part, like I introduced in class on Tuesday, is let's now explore using this tool of measuring blood pressure to answer some questions. One was about blood pressure and pulse versus exercise. One was about the effects of pain, noxious stimuli. Another is the effect of nicotine. So what I'm going to do with you all now is you'll see little videos of what you would have done, and then we'll look at the data and kind of talk about what the data means and how you want to kind of approach this in your lab write-up. So right. Is it? Why isn't it going? Hold on. Wait. Something is wrong here. Are you seeing anything, or does it just say like the spinning wheel?
No, I can see it. I can see your page.
Oh, okay. On my oh, there it is. Okay. So doing the blood pressure lab again. I put like the little quotes because you're not really doing it. You're sitting at home. So one of the things trying to, because you know the protocol asks you to measure your subject in your group. So what I would like you to do as you are doing this write-up, it says initially randomly pick one subject from the Excel file, you know, and pretend that is the data from your subject. Again, I should edit this and say, you know, I'm going to say pretend in quotes because you don't totally pretend. You know, I'm going to say, be sure to say that is actually from spreadsheet. I don't want you to actually have anything where you're kind of, pretending for real. But say like, since we don't have real subjects, I'm using this data from the spreadsheet as my subject. All right, introduction. Let's see what Becky has to say.
There's all the equipment that we're using for our blood pressure lab.
Right, yeah, those little, like the alcohol swabs are so you don't get other people's ear cooties when you're like putting the stethoscope in your ears.
Okay, so using the stethoscope, you want to make sure that the earpieces of the stethoscope are angled where they're angled in a forward direction, because when you put them in your ear, the ear canal will follow that forward direction.
So this, if you ever kind of don't remember, if you try to, so your ear canals don't go straight into your head. If you stick your fingers in your ears, you're going to see you just kind of hit a wall. If you try angling backwards, it's even worse. But if you angle forward, you realize, oh, my finger slides into my ear. So again, this is something we would all do in person if we were actually in lab, but it's something to remember that when you put a stethoscope earpieces in your head, it does not go in just straight in side by side. They actually have to be angled, or else the sound won't actually go nicely down into your ear canal. So
then on this end of the stethoscope, it has two ends, but only one is used at any given time, and it twists. So whatever end you're using, you want to make sure that there's a dark hole where the sound waves are going to come into that side, and the other side should not have a dark hole where it's covered, forcing the sound waves to come into one side.
And for us, since we're using adults, we'll use the larger bell. The smaller bell would be for pediatric subjects.
You can tap it just to make sure there's a really good sound. So
Sure that the stethoscope is over my brachial artery, which is the artery we'll be auscultating. And the sphygmomanometer cuff, this blood pressure bladder, is going to be able to pump up to pressure, which we can read here, and see what your person hears through the stethoscope, the sounds of coric cough that will start appearing as the artery starts getting compressed.
So that was kind of the little background thing. So now what I'm going to do is show you the little video for that Harvard step test. And again, remember, I can review this real briefly. For each of these different challenges, there's going to be, you're always going to start with taking a baseline, blood pressure, and heart rate. So you can see where it is before we start. Then there's going to be this challenge. In this case, it's going to be the Harvard step test. Which is basically stepping up and down for 5 minutes. Then your subject is going to sit down. Then it's 1 minute. So T equals plus 1 minute. You get the blood pressure and the heart rate. at T equals plus 2 minutes. Post this, blood pressure, heart rate. T equals T plus 3 minutes, blood pressure, heart rate. So this is the basic idea, which we're going to see in this little video right now. We'll get a baseline reading, and then they'll do this 5-minute exercise. And then as soon as we're done with that, 1 minute post exercise, get the measurements, 2 minutes post, 3 minutes post. And when we do the next part for the noxious stimuli, the cold pressure test, instead of exercise, you'll be putting your hand in ice water. And once your hand's in the ice water, you'll wait a minute, 2 minute, 3 minute, and take the readings. For the smoking one, it'll be the same, except, person will smoke a cigarette, and then you'll get your 3 readings. All right, so back to our shared screen. Okay, so this is this part 1, Harvard step test. So sit back and enjoy the next 3 minutes and 36 seconds. All right, we're going to start with an overview of the exercise part of the blood pressure experiment, where you're going to take an initial baseline blood pressure and heart rate for your subject while they're sitting quietly. Then you'll start a timer, and they're going to do the Harvard step test, going up and down on the step for 5 minutes. As soon as they're done with those 5 minutes, you now start a new timer, and you have them sit down, and after 1 minute post-exercise, you'll take their blood pressure and heart rate. At 2 minutes post-exercise, once again, you'll take their blood pressure and heart rate. And at 3 minutes post-exercise, once again, you'll take their exercise and heart rate. After you've got your data, you can calculate their fitness index and continue on. For the Harvard step test, I'm going to be stepping up and down in a very specific rhythm for 5 minutes. It's 1/2 step, 1/2 second per step. So 1 and 2 and I have to keep up that pace for the entire 5 minutes. So we're gonna have, she's gonna start me off here. Tell me when to go.
Ready, set, go.
Keep going for 5 minutes. My lab partner here is making sure that I'm not starting to slow down. I'm going slow. She's going to tell me.
Dude. You can do it.
Be careful not to fall off.
4.5 more minutes. Good job. Keep going. Sacrificing your body for physiology. Stop.
All right, so now it's done. Can we start the timer now for as soon as this is done? So it's going there. Now I'm going to get ready to get my blood pressure and pulse taken.
It's okay.
So at 1 minute after the exercise is over, my lab mates are going to be taking their first reading of my blood pressure as well as my pulse rate. For the blood pressure, it's the normal auscultatory method. For pulse rate, you can just get it off of my radial artery, or carotid works as well. And you can either count for 20 seconds and multiply times 3, or 30 seconds multiplied times 2. Obviously, it's going to take at least 2 people, because one person doing the blood pressure, one person doing the pulse at the same time. In the interest of social distancing right now, we can't quite demonstrate that. At 2 minutes post the exercise, we'll take another blood pressure and another pulse rate reading. At 3 minutes post exercise,
we'll take our final measurement of blood pressure as well as pulse rate. And that will be the data gathering for the Harvard step test part of the experiment.
Okie dokie.
That was hard. It was fast.
But yeah, no, it really gets your heart rate going.
Cardio, yes.
If you want to do this at home, feel free. Yeah, no, it's fun. It's the whole point is to really get your, increase your body's needs for oxygen. So we see some real effects. So at the bottom of this, we're going to go through these other ones in time. But right now, I want to just look at the data, particularly from this Harvard step test. So all the data is down here in this spreadsheet that I have at the bottom of this page. And so I'm going to open up right now. And here we go. So this spreadsheet has the exercise stuff. There's like the little tabs at the bottom. Here's exercise graphs, ice water graphs, nicotine graphs. But for right now, we're going to start with exercise. All right. So here are all of our subjects. Here are their baseline readings for systolic, diastolic, and pulse rate. 1 minute post-exercise, 2 minutes post-exercise, 3 minutes post-exercise. And again, I was saying all blood pressure measurements are in millimeters of mercury and all pulse rate measurements are in beats per minute. So that's why it's not up on here, but there's still. To get the this fitness index, you just have the little formula in your lab manual. And like I said, pick one of these subjects. It doesn't matter which one. Just pick one of these 20 subjects to be, your person in your group. You can Valerie virtual lab mate, or I don't know. So some virtual lab mate, this is going to be the data. So when you're calculating their fitness index, use, say which subject you're using and use that for your write-up. But then obviously what we're really interested in also is the overall patterns that we see as we look across the average of everybody. And we can look at heart rate first. Heart rate response post-exercise. So baseline, on average, the heart rate was about 68. Right after, a minute after exercise is done, on average, the heart rate is, 35, beats per minute higher. It's actually like about 50% higher. Again, why would that make sense?
Because the cardiac output is still pretty high.
Right. So this is, remember, so we're going to be in oxygen debt. We're going to need a lot of extra oxygen getting delivered in order to recover from all those anaerobic pathways. And how are the ways you get to increase cardiac output?
Increase in diastolic volume, or like increasing the contractile force.
And heart rate.
Yeah, but yeah, I mean those yes, but the ones that are relevant here are, increasing your heart rate. Remember, cardiac output is stroke volume times heart rate. So if we're increasing the heart rate, we're increasing the stroke volume. I mean, but if we're increasing the heart rate, we're increasing the cardiac output. Right? So that totally makes sense. And again, you can see this recovery. As you wait, the heart rate is returning back towards resting. And it's going to be different for different people. This is on average, But like I was mentioning, what the heck? As I was mentioning last time, there is a huge range, and it's usually used as a measure of fitness, how quickly you return to resting after. In fact, the two things, how things, when people are more fit, in general, their cardio, like their heart rate does not have to go up quite as high from resting to deal with the stressor, and you return back to resting quicker after deviating. So again, different people have different responses, but this is the average. And then for blood pressure, what do you think is going to happen to blood pressure if you're trying to increase the flow? It's going to go up, right? Blood pressure times resistance, what, or flow is blood pressure over resistance. So if we are increasing the pressure, we're going to increase flow. And this is what we see. What is striking about this?
The diastolic pressure, it didn't change that much.
Exactly. So this is important. This is actually an important thing to notice, important thing to discuss in your write-up. You know, yes, blood pressure increased, which is what we'd expect in order to increase the blood flow, but it was a systolic that increased. And it's, we got the same kind of pattern we saw with the pulse. It gets high and then it's slowly recovering as your body is getting back. But diastolic really does not shift at all. Again, why does that make sense? Why would it be counterproductive to have the diastolic way high?
Because if you have a high diastolic, it's going to fight the ventricles as they pump out. You're going to have to overcome the diastolic pressure for the blood to eject.
Right, exactly. So does everybody hear what Stephen said? He's, you know, diastolic is what's in the arteries while the ventricles are refilling. That's what the ventricles have to overcome during contraction to actually achieve ventricular ejection. So if the diastolic had risen appreciably, that would mean the heart's squeezing way harder than normal just to achieve ventricular ejection, to get blood to leave the heart, which is not kind of what you're looking for. You know, so in your write-up, you know, you can discuss both the, you know, the heart rate responses, blood pressure response, systolic versus diastolic, you know, kind of talk about what's going on, why this makes sense. Any questions about this part one?
For oxygen debt, because you're kind of doing like aerobic exercise, how does the cellular respiration fit in to the heart rate?
I mean, if you were just doing even increased aerobic respiration, you would probably increase the flow to some degree. The more blood you've got going into your muscles and all, but I'm talking about the anaerobic respiration and the oxygen debt because we're actually seeing all this activity while you're actually not working. You're sitting in the chair getting your measurements taken after you've already finished the exercise.
All right.
So I wanted to make that connection that what you're seeing here is not in response to the exercise as it's happening. It's actually paying off the oxygen debt now that you're done with the exercise. You know, if you were able to measure the pulse and the blood pressure while you're running down the track or something, or, you know, you would also see something similar, but it would be trickier because everybody's moving around. All right. Well, here we go. So the next part, the cold pressor test. Cold pressor test is a classic way to have pain as an independent variable. There's lots of research studies out there where they're curious how different things respond to stress of pain. And obviously you don't want to have pain that's going to result in actual tissue damage. So we have this ice water, which will be really uncomfortable, but won't really hurt you. And so we're going to see what happens here. I'm going to first show you how this works through the video. And this is kind of nice. We had Becky do the pain instead of, it was more fun to do the exercise, I think. All right, here's an overview of the cold pressor test part of our blood pressure experiment. You'll start by taking an initial baseline reading of your subject's blood pressure and heart rate. And again, pulse rate and heart rate are the same here. Immerse your subject's hand in ice water and start your timer right away. Make sure that the water and ice are in equilibrium so we know it's 0 degrees C. After they've been immersed for 1 minute, you will take their blood pressure as well as their pulse rate and record that, keeping their hand in the ice water bath. After 2 minutes, you again take their heart rate and their blood pressure. After 3 minutes, again, you take their blood pressure and heart rate. And at this point, they can now take their hand out of the ice water bath. Then you can continue on with your experiment, calculate their index of response and all.
Okay, so the noxious stimulus and blood pressure relation. I'm going to stick my hand in ice water that has been equilibrated, so a little bit of time for the ice and the water to reach 0 degrees Celsius. And once the timer starts, I'm going to immerse my hand, keep it immersed. My group mates will be taking my blood pressure and pulse for 1 minute after, 2 minutes after, 3 minutes after, while my hand is immersed in ice water the entire time. When we take the pulse, we want to take it from the carotid artery this time because one, if I took it from my radial artery in the ice, that's not doable. And if I took it from my hand that has the arm that has the blood pressure machine, this sphygmomanometer on it, there's no pulse during the time that the cup's inflated. So the carotid artery is the better artery to take beats per minute.
So now we're going to start this experiment. So I've got the timer here. And I'm going to go start as soon as are you ready to put your hand in the ice water?
I think so.
All right, so here we go. Start. She's got her hand in the cold pressure test, ice water, and at 1 minute, we're gonna take the first reading. It's genuinely designed to cause pain, but not tissue damage, but it can be quite uncomfortable. Although, all right, so it's almost 3 minutes. At 3 minutes, okay, now it's time to take the final reading, our third reading. We'll have someone with her blood pressure and her pulse. And now we're done. You can get out. All right, you can notice there's that like kind of reflow. It's typical for your hand to get kind of bright red afterwards. Thank you for being such a great participant. All right. So you kind of see how that goes. I mean, we were making these ones right after the shelter in place came in, so we couldn't actually show you the actual taking the blood pressure. But normally, while the person has their hand in the ice water, there's going to be one, taking the blood pressure on the other arm, another person with their hand on their neck taking their pulse at 1 minute, 2 minutes, 3 minutes. And the data for this one, I should mention we have to talk about index of response. So this is trying to look at how far from resting their blood pressure goes during the noxious stimulus. So there is some, there's resting, systolic over diastolic. And we look at what is the maximum of difference between resting and pain, for either systolic or diastolic. So you take a look at, let's say this was 120 over 80. And during their cold pressure test, they went up to 150 over 90. We would say, aha, this is the maximum difference here between these two systolics, that's 30. This index of response would be 30, because the largest difference between either the systolic or the diastolic is 30. If somebody went up to like 128 over 78 or something, if they did this, this would be a index of response of just 8, because that's the largest difference between during the pain and their resting. So index of response, you just look at what are the values for systolic or diastolic while they're at rest, compare them to the maximum changes that happened during the ice water bath, and you just pick the highest value, and that is their index of response. So we can take a look at the data in the spreadsheet that goes along with this part of the lab now. So again, I'm on, remember before we were on the exercise tab, but now I'm going to be on the ice water tab. This is the data for the ice water. And again, pick one of your subjects as your subject, and that will be your subject for your write-up. Again, for each of these, we have systolic, diastolic, and pulse rate. I actually did these calculations here. This max systolic, all I did was I looked at the systolic for each of the ice water readings, and I used the Excel max function. So it's what is the largest, what is the largest of the diastolic, what is the difference between the largest systolic or diastolic with the resting. Then I took the largest of those to be the index of response. So this index of response, in this case, this is one of the labs where we don't actually, it doesn't help us to average things. We're not interested in what on average happened here. What is way more interesting here is to see how variable the responses are. If you look along here, you get some people who are what we call hyperreactors, had really large changes, up to 40 millimeters of mercury difference between resting and during the ice water bath. Some people were way lower, barely changed at all, 9, 10, another 10. These are what we call hyporeactors, low responses. So that's an important, like when you're discussing this data, again, the average is not what's as interesting here. What's interesting is how kind of diverse the responses are. And again, if we look at pulse rate, subject 1, their pulse rate started out actually kind of high. It went down and actually got slower and slower from reading to reading. As they stayed in this super painful thing, it went way down. If we look at another person, this person here went from less than 60 to 65. Then this, I don't actually trust that. This one went from 54 to 64. This one went from 64 and stayed almost the same. This one went up 10. This one went down. So just, I think it's really useful, particularly because most people have this kind of intuition that, oh yeah, I mean, being in intense pain is gonna jack up your pulse rate and jack up your blood pressure. And it's, the answer is like sometimes, and sometimes totally not. And it's pretty common either way. So that's part, I mean, that's part of the main reason I like doing this lab in this class, is just to show you a very clear example of these idiosyncratic responses, of just how each person responds to the same thing in very different ways. And you have to be careful about making assumptions about what's going to happen. So, and again, when you go off into a clinical setting, people respond differently to all sorts of things, respond differently to different stressors, respond differently to different drugs, So I think it's very useful to see, a lot of what we're doing in this lab is looking at, on average, what are the patterns we see. But I also think the lab is really useful to drive home the point that in reality, there's a lot of variation from person to person, and that is important to pay attention to. Because if you just assume everybody's the same, you're going to run into trouble. So any questions about this one? Okay, dokie. So the final one, we're gonna come back to the where'd it go? Come back here and nicotine challenge.
All right, part 3 is going to explore the effects of nicotine on your cardiovascular system. It's structured just like the other 2 experiments, and here I'll tell you all about it. All right, for the last part of our blood pressure lab will be a nicotine challenge. This is for educational use only. I don't recommend this as a habit. It's not that good for you. For this one, again, we'll have taken a baseline reading on the blood pressure and the pulse rate, and then the subject will smoke a cigarette, and basically you get the nicotine into the body. And at that point, as soon as you're done with the smoking, the subject is going to sit down, and we start the timer again. And it's just like the other parts. 1 minute post challenge. They'll take my blood pressure and my pulse rate, and that will be the first reading. 2 minutes after I'm done with the cigarette, we'll take blood pressure and pulse rate. And finally, at 3 minutes post-smoking, we'll take the blood pressure and the pulse rate, and that will be our data for the nicotine challenge part of the blood pressure lab.
Okay. I look like I'm about to sell somebody a used car or something. It's only been driven on Sundays by a little old lady. It's an amazing deal. Let's see. So again, going back to the data. We have nicotine. So if you look on average, pulse rate goes up. And this is, for the most part, it's pretty consistent, although not always. In general, nicotine does 2 things. One, it's a stimulant, so it's going to speed up your heart. And also it's a vasoconstrictor. And again, if you have a vasoconstrictor, what's that going to tend to do to your blood pressure.
Increase.
Right. So if we take a look here at our graphs, we can see on average, again, this is like acute nicotine, right? This is you've just put a bunch of nicotine in your body and it's working at the moment, speeding up the heart rate and also increasing the blood pressure. So that's kind of typical. You know, there's a lot more to nicotine than these acute effects. A lot of the connections between smoking and cardiovascular disease aren't directly related to, you know, what you're seeing here. It's kind of more kind of like when I was talking about the relationship between diet and atherosclerotic plaques. There's kind of a more involved process with inflammatory responses and all that. So nicotine has this kind of acute effect of raising heart rate and blood pressure, both through vasoconstriction and kind of being a stimulant, but then it also has other long-term effects that are not good for your cardiovascular system. What else? One of the interesting things, sources of variability. I've always talked about how you have to be careful. Like we've done this experiment for many, many years. Like, I've been doing this one for like 20 years. And there's usually, people who smoke and they'll do the smoking and will usually get similar data. And it was a few years ago, we had really bizarre values for the baseline, like heart rate and blood pressures. Like, it really didn't have this thing where it started low and went up. And we're trying to figure out what's going on. And it turns out we figured out, we kind of through like interviews with the subjects, it was when they had changed some of the rules on campus and got really strict about busting people for smoking on campus. So the people who were on campus, smoking a cigarette to do this experiment, it turns out they were just terrified that they were going to get into trouble or something. And it seemed like that was what was jacking up their heart rate and blood pressure before they even started smoking, which was kind of hilarious. So I had to kind of change the instructions and make sure people realize like I'm gonna, it's okay, and I'm gonna make sure they don't get, so it's fascinating though. You have to be careful. These sources of variability sometimes can sneak up on you. When you get weird results, maybe they're true, but it's usually worth spending a little bit of time to figure out, like, did something go wrong here? Let me figure out if this is really real or I missed something. Sometimes you miss something, but sometimes there really is something fascinating and weird going on. Again, in your write-up, it's just kind of describing what you see and kind of why you think it makes sense. I guess that's it. Any questions about that? So again, all of the data for all three parts is just in the spreadsheet here at the bottom of the page. So it's easy to find. And then again, there's the submit. Where do I have it? I don't even, I have it due November 21st. So again, I'm trying to make sure people kind of keep moving and don't get caught, because I've been noticing not everybody, but a number of people tend to kind of leave things right before they're due. So I want to make sure you don't get caught up at the end of the semester with too much to try to do all at once. So that is that.